I was a zebra. No, not the relative of a horse that's striped and lives on the Serengeti plain. But you see, in medical school, they teach new students that most patients that they will see in their lives have common diseases. Those are the horses. And only very rarely will a patient come in with an unusual or exotic disease. Those are the zebras. If you spend your whole time looking for zebras, you'll miss an awful lot of horses. When I was 9 months old, my mom thought my forehead looked funny, so she took me to the doctor. It turned out I was one of those zebras. And if it wasn't for the brave surgeon who worked on me, I wouldn't be alive here today. And ever since that time, I felt a desire, a need, even a compulsion to pay back the universe for that brave surgeon who worked on me. I became a biologist, a research scientist, and now I'm a director for a major life sciences company. And I still want to find ways of innovating clinically to pay back that surgeon for the great work he did on me. I work for a company called Cytiva. We're part of the Danaher Life Sciences platform. Our vision is a world in which access to life-changing therapies transforms human health. We don't make therapies, but we help our customers to discover, design, and manufacture therapies to treat patients. Therapies like insulin to treat diabetes, monoclonal antibodies to treat rheumatoid arthritis, vaccines to prevent terrible diseases like COVID-19, and even teaching a patient's own immune cells how to fight the cancer. In the future, the therapies that we develop will be much more personal than they are today. We will help our customers to diagnose and discover and treat patients in a very specific way. You see, we all know that one size fits all means that nothing ever fits. And it's only by making a personal diagnosis and making a personal therapy and treating a personal disease in a way that most effectively treats that patient will we truly be able to help patients the most. My own father was a disabled veteran, and if he didn't have this kind of personal care when he was alive, and so he spent the last 15 years of his life confined to an electric scooter. We want to help the VA make care for their patients that treat the patient in the very best way. We want to help the VA to be able to diagnose and treat patients very personally so that we can give the right patient the right treatment to treat the right disease at the right time, and do that through personalized medicine. I want to tell you about John. John is a retired Army veteran. In his retirement, he found fulfillment in driving a school bus for the local elementary school. And he took great pride in the fact that he could say hi to every kid as they got on the bus and remember their name. But John developed throat cancer. And the surgeons at the VA hospital in Puget Sound were able to successfully treat that throat cancer, but in the process, they killed a portion of his jaw. Without his jaw, he couldn't eat, he couldn't drink, he couldn't sip through a straw, and he was in a lot of pain. But most importantly, he looked deformed and grotesque, and the students were afraid to get on his bus, so he lost his job. Well, the surgeons at the VA did an amazing surgery on him. It took 2 teams and a 14-hour surgery, but they took a piece of bone from his leg and reshaped it into a piece of jaw for him. And after he recovered, indeed, he wasn't in pain. He could eat again. He could drink again. And most importantly, he didn't look deformed and grotesque. So the kids weren't afraid of him, and he got his job back. But unfortunately, that piece of bone in his leg was important, and John will never walk normally again. You see, he had to trade one disease for another. You may remember Dr. Beth Ripley. Dr. Ripley stood up here in 2018 and told you about this crazy idea that we had of a new way of treating patients like John, where instead of taking a piece of bone from his leg and spending 14 hours in a surgical suite and tying up 2 surgical teams, and trading one disease for another, we wanted to be able to precisely manufacture in the laboratory a new piece of bone to fix the jaw of patients like John. It was a crazy idea, but we promised in 2 to 3 years we'd be in our first patients. I'm here to tell you that even with the COVID-19 pandemic, we're on schedule to deliver on our promise. To do such a thing, is more than just printing a piece of plastic. You see, if I print plastic, it has to physically be right. It has to be the right shape. But if I'm printing living bone, it has to physically be right, but it also has to be right chemically, and it has to be right biologically. And to make the things we need to do to make sure that it's right all the way through that process are different than what we do to just print a piece of plastic. So to do this, we had to design a whole way of taking the patient all the way from scanning to surgery and manufacturing of that bone, where we could control the quality throughout the whole process. And so we had to, important part of that was the ability to be able to print and inspect and grow and inspect and continually put this inspection process right in the middle of the development process for developing that bone. Well, I'm here to tell you today that even with this pandemic, we've done our first animal studies and the results are remarkable. The bone grows, it vascularizes and gets blood vessels just the way we had hoped it would. And those are two giant steps on the way to being help patients just like John. But we're not done. We can have the best invention. We can invent the best piece of bone, have the best surgeons to put it in place. But if we're not able to implement it in a way that helps patients, we'll never get there. You see, an innovation is invention times implementation. And it's not just inventors, but we need everyone along the way to help us to take that invention and implement it in a way that's innovative and takes care of patients. That means we need contract managers and procurement experts and nurses and even janitors to help us get across the finish line. Here's our team. Across the top, we have Beth and Jeff and Zane and Monica, and they're all work for the VA and the University of Washington in Seattle. In the next row, we have our friends from Advanced Solutions Life Sciences, Michael and Jay and Sarah, and incredible work that they're doing. And on the left, we have me from Cytiva. But this isn't the whole team. With this team, we're not going to get across the finish line. There's a critical person missing. And that person is you. Won't you join us? Won't you help us innovate for veterans like John? Thank you.